A very good afternoon, ladies and gentlemen. Welcome to Forum 4 of the 14th Medical Korea Conference, which is themed The Paradigm Shift in the Global Healthcare Market Brought by Digital Technologies. My name is Soa Kwon, and it is my absolute honor and pleasure to be your MC for this forum. Along with the opening ceremony yesterday, Medical Korea 2024 is presenting a variety of programs, both online and offline, through today, focusing on the theme of connected healthcare for all, a new horizon beyond barriers. So, first of all, I would like to express my sincere gratitude on behalf of the organizers to all of our distinguished guests and all participants for being here with us today. I'd like to note that this forum will be conducted in English, and we are providing simultaneous interpretation in both Korean and English. So please make sure to use the interpretation receivers handed out to you on your way into the venue. Channel 1 is for Korean, Channel 2 is for English. 네, 오늘 행사는 영어로 진행될 예정이며 동시 통역이
Today's
제공된다는
forum
점
will be
다시 한번
conducted in English, and we are
안내드리겠습니다.
providing
채널
simultaneous
1번이
interpretation in both
한국어입니다.
Korean and English.
And
Channel
in addition,
1
if you need
is
any
Korean.
assistance during the forum, please reach out to our staff on standby here within the venue. Also, you can watch the live stream of this forum and actively participate in the live discussion on YouTube. So just type in Medical Korea 2024 or Medical Korea Official Forum 4, and you can find the live stream of this forum. We appreciate your interest and encourage your live participation. So before we dive into Forum 4, I would briefly like to go over the agenda. Forum 4, the paradigm shift in the global healthcare market brought by digital technologies, is prepared to explore ways to excel in the global healthcare market by deepening the understanding of the paradigm shift in the global healthcare market and future medicine. Therefore, we have invited esteemed guests, experts from globally competitive countries with advanced healthcare to share insights and case studies on the adoption and application of digital technologies in the healthcare industry. Forum 4 has a total of 5 presentations prepared by global opinion leaders, each within a 30-minute slot. For the first 3 presentations, we will be hearing from insights from hospitals from home and abroad, and then take around 15-minute break. And once we resume, healthcare companies will deliver the final 2 presentations. The first presentation, titled Survival of the Digitalist, How Technology is Reshaping the Global Healthcare Market, will be delivered by Mr. Edward Marks, CEO of Marks Advisory. Following that, Mr. Jong-soo Choi, CTO of Office of Samsung Medical Center, will present on the topic Digital Health Transformation Based on Patient Journey. And in our third presentation, we have Mr. Ji-tu Jos, the Vice President of Apollo Hospitals Enterprises, who will share his insights on the topic Clinical Collaboration, a Global Perspective. The fourth presentation will be presented by Mr. Hyun-seok Choi, CMO of DeepNoid, who will present on the topic Considerations in Developing Medical AI Software. Last but not least, Ms. Hope Lewis, CEO of More Health, is expected to deliver the final presentation under the topic Access to Great Healthcare Should Never Be Constrained by Borders. So we are honored to have these 5 esteemed healthcare experts join us despite their demanding schedules. And for me personally, as the MC for this session, I am also thrilled to personally listen to these presentations. And I encourage both our online and offline participants to anticipate their valuable insights and stay engaged with us until the conclusion of this forum. Now, without further ado, let's commence this forum themed The Paradigm Shift in the Global Healthcare Market Brought by Digital Technologies. And we'll do that with our first presentation. Our first presentation's topic is Survival of the Digitalist, How Technology is Reshaping the Global Healthcare Market. Mr. Edward Marks, CEO of Marks Advisory and former CIO of Cleveland Clinic, will deliver this presentation. Edward Marks has been recognized as the HIMSS CIO of the Year and has been selected by Becker's Healthcare as one of the 25 most influential executives in healthcare, 26 smartest IT experts in healthcare, and one of the 17 leaders in healthcare. Under Edward Marks' leadership, the Cleveland Clinic has achieved HIMSS MRAM Stage 7 certification in healthcare IT and has won the HIMSS Davis Award twice. So, please allow me to invite him onto the stage with a huge round of applause.
All right, thank you very much. I'm super excited to be with you in the next 30 minutes and share with you really what others like yourselves have taught me, but in a consolidated fashion in 30 minutes. So we'll just jump right to it. So you already know a little bit about me, and you can find out more about me by going to LinkedIn, so we won't bore you with any of that information. But what I do want to talk to you about is survival of the digitalist, because if we do not embrace digital technologies that we're all familiar with, we will no longer cease to exist. And we're seeing that globally, that organizations who are unable to make that shift, are unable to execute well, get acquired, or they close, or they don't become the standard that they once were. So what's happening? So let's talk a little bit about 3 things that are happening globally. Then I want to dive into 6 technology areas, which you're all expert in, and you'll hear from others who are much wiser than I am on the deep technologies. But I want to finish with 6 things I learned that will enable you to be successful implementing the technologies. Because it's one thing to have the technology, but it's a whole other thing to be able to implement and execute on the promise of digital innovation. So there's really 3 things, right, globally, that are driving all of us. The first one, of course, is clinical. It's all about our clinical processes and quality of care, and how digital innovation is enabling us to improve the quality of care and our processes. The second sort of meta theme, if you will, is the customer and clinician experience. Finally, although we've been talking about it actually for years, but finally we're starting to embrace the notion that we must be digitally innovative to give our patients and their families a better experience. Because even at world-class organizations, such as the ones that exist here and others globally, we still do not deliver completely on the optimal experience. There's other industries that do consumer experience much better than we do with our patients. But at least we're paying a lot more attention to it, and we do have the technologies, which we'll talk about, to enable those experiences. And of course, and my wife, who's a doctor of nursing, she would be disappointed in me if I didn't talk about how we need to improve the experience of our clinicians, both the nurses, the physicians, and everyone who touches patients. And the third mega theme is something that's been around for a long, long time, although we speak about it like it's something new, but it's robotic process automation and all things AI. So 3 mega themes that we're all aware of that are sort of driving this survival of the digitalist. So I told you, let's talk about 6 things that are really taking us to that next level with technology. So this is what we're going to talk about, is how do we accelerate the evolution. But first, I want to show you this chart. So this was my 1-page plea to my former organization when I served at the Cleveland Clinic to lead and succeed with digital transformation. So I was tasked to be the leader of our organization globally to lead our digital strategy. And in order to receive the funding to execute on that promise, this is the chart I came up with. And if you think this is a pretty simple chart, you should have seen the handwritten version that I had of this. But it's pretty simple, right? And this exists in almost every organization. In fact, I would say every organization. There's a gap between the promise of technology and the level of clinical care that we deliver. So in our organizations, we deliver excellent clinical care, but the technology lags. What happens when technology catches up? That's when we see true transformation. When technology catches up to the level of clinical quality in our organizations, then we achieve true digital transformation. So all of us are working on that. Like if we're CIOs, we're all working on that with others in the organization to close that gap. But what really helped accelerate the closure of that gap was the pandemic, right? Because of course, we were able to deploy technologies a lot quicker than normal. We got rid of a lot of bureaucratic processes because it was all about patient care. We were so mission focused. But what happens when we see that gap close completely? That's why we're all here, right? Whether you're a supplier, whether you're a manufacturer, whether you're an executive of a health system, whether you're a clinician, this is why we do the things that we do. This is why we are so passionate about serving in healthcare, because we want to see those two intersect, because what happens at the end? Yeah, sure, we do get better experiences, we do improve the quality of care, but ultimately we save people's lives. And that's truly, right? That's the foundation for all of us in this room. All right, so those 6 things that are helping to reshape healthcare. So the first is tech advancement. So we've been here, it's never been a tech issue, right? We've always had the tech. The tech has always outpaced our ability to deliver. But we got great tech now. And so we can never try to use tech as a reason why we can't deliver. But we see this quite a bit. There's a lot of opportunity for differentiation with our technology. There's a lot of opportunity to really improve quality of life, like with genomic editing. And we all have seen the early studies of how that's really impacting the quality of people's lives. It's extending people's lives. Market disintermediation, right? We're seeing the emergence, and here in Korea as well, of a lot of private hospitals. And so we're seeing new entrants into the marketplace that we did not have to contend with in the past. In where I come from in the United States, it's a lot about our insurance companies that are competing now directly with our hospitals. In fact, they're opening up their own hospitals. In fact, they're buying most of the physician practices that exist as feeders into the hospital systems. We're also seeing big tech, right? Amazon, we can now do virtual visits with Amazon Prime. So we get our great videos that we can watch, but now we can also get virtual visits. So we're seeing a large disintermediation, even retail. We have big stores like you do that are now delivering healthcare that in the past, maybe they sold TVs, they sold stereos, and now they're selling healthcare. So it's huge changes that are taking place. And another reason why it's survival of the digitalist, because if we don't pay attention to these forces, our organizations will be minimized and perhaps no longer exist. And of course, it's a global marketplace. As we know here in Korea specifically, the emergence of medical tourism, right? You get really good at doing something really well at a very favorable price point, and it's convenient for people to travel from all over, not just Asia, but all over the world to seek care here. So we no longer have borders that used to separate us. But now it's truly this global marketplace. And of course, education as well has changed everything. We can deliver a lot of this education virtually. We can deliver even where I came from in our medical schools, where we no longer used cadavers. Everything was virtual reality and augmented reality. And so you're able to deliver not only care around the world, but you're able to extend the education of future caregivers as well. And of course, it's been around for a long time, but it's getting better, is our ability to do software as a service and infrastructure as a service and source to around the world various aspects of our technology. And that enables us to focus on what we do best and allow someone else to help us in areas that have become commodities. So those are 3 of the 6. The other 3 is ubiquitous health. The world is definitely flat, as we were just speaking about. And so now we can do all this care virtually. We have virtual nursing. So we have command centers, and I know you have them here as well, where you can take care of patients around the world, around your country. You no longer have to be physically present. We were even contemplating and are working on the ability to do surgeries virtually remotely. So in the past, if there was a particular situation, we would sometimes send our care team. Imagine that, and the cost of time and money. We would send care teams to different parts of the world, which meant they couldn't take care of patients where they were located, but they'd have to get on airplanes because they were super specialists, and that patient was unable to travel to where our locations were. But now, through robotics and the virtualization of care, able to deliver complex surgeries like mitral heart valve replacement virtually with robotics. So it's here, and you're going to see it continue to evolve. Obviously, we know all about hospital at home, where our goal is 25% of inpatient stays would be taken care at home. And what we found, and studies have shown, that when you do this sort of virtual care, that the costs are half, the patient satisfaction is almost twice the amount of being in a hospital, and the quality of care is the same or better. There's other organizations like Mayo Clinic who does a version of this where they have hotels near some of their facilities. And instead of keeping that patient in a hospital, which is dangerous, which is uncomfortable, they allow them to go next door to a hotel where it's more comfortable, it's less dangerous, and it costs a lot less. So we're going to continue to see this shift of lots of things that we used to admit patients for or keep patients for in our hospital beds for a long time go all virtual. So it's really an exciting time. And then, of course, cloud transformation. And you all know this, so I'm not going to spend a lot of time on this, but this has really helped. But quantum computing also has emerged now. So in the past, when we did research, sometimes our studies, our queues, we go through so much data, it would literally take days of compute time. And now with quantum computing, we have reduced that time by over 95%. And that's just one simple early example. We're going to see a lot more capability, especially as we talk about AI, generative AI, and learning language models and those sort of things when you add quantum capabilities to it. And then, as we spoke about in the beginning, as one of the 3 meta themes is this focus on experience and thinking about human-centered design in everything that we do and make things simple for our patients. Some people were asking me earlier today, for what are some examples on how we can leverage new technologies? And, again, the technology isn't so much new, but it's our application of the technology. And my favorite examples are simple, where while receiving chemo, instead of thinking about, oh my gosh, I have a needle in my arm and I'm receiving chemo and how uncomfortable it is and why do I have cancer, they're able to spend time virtually in a zoo and go visit their favorite animals. A simple example, but profound nevertheless. And so we need to start embracing more and more of these capabilities to make their lives as best as possible, their experiences as best as possible. And just, we've had wearables for a long, long time, but we don't use them very much on the provider side. So our patients and their families have lots and lots of data, but how often do we actually take that data in and make any sort of analysis? But as they become easier to understand, easier to interoperate, we're going to see those wearables come in very, very handy in the overall experience. Because right now, and maybe your hospital's different, and maybe your patients are super, super happy with their experience, but I served in wonderful, wonderful hospitals and health systems where we had global reach. And I've yet to find a patient that's happy about being a patient and that the experience is that great. So we have work to do, and these are 6 areas of technology which are disrupting or sort of reshaping healthcare as we know it. And as I mentioned, it's one thing to talk about this, and again, what I just shared with you is probably not new for many of you, but what I want to shift to next in our last couple of minutes is 6 ways to implement these technologies to ensure that we're using them to their maximum capability to ultimately save people's lives. So, again, some of these you're going to sit there and think, oh, why is someone telling me about these things? Because I know them. And that's great if you do. And I'm super happy for you, and you should share your success with other people. But I'm telling you, as someone who's done a lot of research around the world, compiling information for multiple books, that it's not happening at scale. So that's why I just want to share with you what others have shared with me that have ensured the success of leveraging next technologies to improve the patient experience, to improve the clinician experience. So there's 6 things, and they're rather easy. I'm going to go through them very quickly. So one is the inspiring vision. What's your inspiring vision for your organization? Again, whether you're a manufacturer, a supplier, a clinician, or you're part of a hospital executive team, what is that inspiration that keeps everyone focused on the mission of the organization? Oftentimes, I'll just ask people casually, tell me about the mission and vision of your organization, and not every time are they particularly excited or even recall what it is. And so I'm always about to saying things very simply. And so wherever I've been, we've interpreted our mission and vision of our organization, and from a tech perspective, it's we save lives. Everyone in my organizations knew the reason they existed was not because they were a great network engineer, not because they were a great database administrator or an analyst for an application. They knew they were saving lives. And it wasn't just a cute slogan, because we would have clinicians and patients as our guests whenever we met like this, and they would tell them how their life was saved or one of their patients was saved because of the digital innovations that that team was responsible for. So you've got to have the inspiring vision, you've got to know what your problem statement is, and you have to operate with a team of teams. So in the past, our organizational structures have basically said, you're the leader, and it kind of goes down like when they built pyramids back thousands of years ago, that we use the same organizational structures today as we did in those more simple days. And that to me doesn't make sense. We need to be about team of teams. We need to be about shared decision making. We need to be about allowing the people that serve with us to make decisions and not rely just on one person. And it takes courage, and it takes leadership and humility to be able to do that. But I guarantee you, if you adopt a team of teams model, you will find greater success. And that's why we were able to accelerate digital innovation wherever I've been, because if it was just me, we would have been in a little bit of trouble. Because 1, I can only handle so much, and 2, I'm not the smartest person in the room. But I knew on my team we had much smarter people. I knew on my team we had much more breadth and depth of capability and resource. And so by forming these team of teams and empowering people, empowering others, and including patients in our structure, that we were able to deliver on the promise. So those are 3 of the 6. So 3 more is the ability to really have a strategy. And this is another test that I do. I never do it publicly because I would never want anyone to feel bad, but I just do it intellectually. And so I ask, how many of your organizations have a strategy for digital transformation or anything digital, even an IT strategy? And if I were to ask, about 50% said they do. But when I asked them to show me, it's 5%. So a lot of us have strategy perhaps in our mind, but we've never actually written down the strategy. So it's hard to execute on a vision and on digital innovation when there's no strategy. And that leads to resource commitment. So in order to be successful, you also have to have resource commitment. That's why I always embrace anyone who has the ability to say no to anything we do. We embrace them in the team of teams. So you know what? On our team of teams, and I know it's the same for all of us globally, it's hard to get resources. There's only so many resources, but how do we do it? In the very beginning, everyone is on that team of teams, including finance, if that happens to be the area that's hardest, which it has been for me. we have them on the team from the very beginning, so that when we go to be resourced, maybe it's finance that is speaking and not me or not you. And then execution and resilience. So the ability to execute, and we all know, despite great plans, despite great strategies, things go wrong, things happen, but it's that ability to lead through it and correct, take a step back, reformulate, but keep your eye on the vision and to execute. So I said 6 best practices plus 1. So I just gave you 6. So we talked first about the 3 sort of meta themes of what's going on for survival of the digitalist. Then I shared with you 6 areas where technology is changing the global landscape. Then I just finished with 6 ideas about how to execute on the promise of digital innovation. So I want to finish with 1 more. So this brings together the digital innovations and the technology and how it saves people's lives. So in 2018, on April 7th, I was in a race. I'm on Team USA. I think this was my 4th year. Team USA triathlon and duathlon. And every year you have to run in the national championships in order to make the team be in the top 10 and then go to the world championships. And so in 2018, in the last 2 miles of the race, I felt this heaviness on my chest like I've never felt before. And I thought to myself as I was running, I can't be having a heart attack because I'm an athlete and I get care at the Cleveland Clinic. It's impossible. And as I ran, I thought to myself, well, if I was really having a heart attack, I probably couldn't keep running, but I was running, although I had slowed down my pace quite a bit. So I was reasoning, and I thought about door to balloon time, right? Within 60 minutes of lack of oxygen to the heart, lack of blood, your heart becomes damaged. And so I was calculating these times. If I stopped in the race, how long would it take for an ambulance to get to me? How long would it take for them to stop a race? So I figured I had 2 miles left. That means I have about 12 minutes to get to the finish line. And so as I raced to the finish line, I passed the finish line, I checked into the medical tent, and sure enough, we use technology. We have a little credit card, EKG, attached to the iPhone, goes to the hospital. Sure enough, you're having an LAD, a widowmaker. And so immediately I was rushed to the hospital. Of course, they did the cath. They removed this random obstacle in my LAD, and I was back whole again. And here's the kicker. So I said, well, I made the team. Yeah, it was number 10. You have to be in the top 10. I made the team. We have the World Championships 90 days later, and they laughed. But I talked the physicians into allowing them to use my wearables, to allow direct interoperability into our medical record, for the clinicians to review those medical records on a timely daily basis. They started adjusting my meds on a regular basis. It's a long story, but this is the end of it. 90 days later, after my cath, after the use of all these technologies, crossing the finish line, World Championships, representing our Team USA. Only possible because of who? Because of you. Because of no matter what you do, whether you're a clinician here, whether you're part of the C-suite, whether you're a supplier, it's because of you that these sort of stories happen. We need more stories like them. And they're only going to happen if I take hold of this vision. How do we digitally enable our enterprises? How do we not take no for an answer? And how do we collect this team of teams to make sure that everyone that we care about, everyone in our country, in our cities, everyone around the world has an opportunity to improved experience, to improve quality of care, and ultimately to have their lives extended. That's it. Thank you very much. I appreciate the time today. Thank you.
Thank you very much for that fantastic presentation and sharing your own story. And that really highlights the fast technological changes, and with that demonstrating how much we should pay attention to this huge shift, so to make the best of it for the benefits in healthcare. So why don't we give Mr. Marks another big round of applause for that presentation. And next up, the second presentation awaits us. Under the title of Digital Health Transformation Based on Patient Journey, Mr. Jong-soo Choi, CTO of the Office of Data and Digital Transformation at Samsung Medical Center, will deliver this presentation. Samsung Seoul Hospital, the first hospital in the world to achieve the HIMSS Triple Crown, is leading digital healthcare innovation in Korea by optimizing patient experience and improving operational efficiency. So now please allow me to invite CTO Jong-soo Choi to the stage with a big round of applause.
제가 에드워크스처럼 영어를 잘할 수 있어요. 영어로 하면
I hope I could speak English so proficient fluently like Edward, but I can't, so I decided to speak in Korean. Currently, I work in Samsung Seoul Hospital and I am in charge of digital transformation. I started working in the hospital in 1993 in Samsung, and the hospital was established in the hospital was established in 1994, and then I've been in charge of IT for several decades now. In Korea, we say that in a decade, even the mountains and the rivers change. And since the launch of Samsung Seoul Hospital, there's been a lot of hospitals that were established. So there has been a lot of changes in the landscape. Currently, we have 2,000 beds, and we carry out 200 operations, and the average length of stay is only 5 days, 5.3 days, or at most 6 days. So we're a very busy hospital. So when I explain the hospital, I usually compare this to how we scan books. In 1994, we set up 4 pillars for the IT strategy for the hospital. So first of all, prescriptions were all paper documents. So we embarked on HIS to become paperless in 1994. And nowadays, we obviously have digital images, but in the past, we had a lot of films, and you have to get the films from the view box. So in 1998, we decided to go filmless, and in 2003, we decided to go chartless, moving away from the paper charts that the physicians used. So we wanted to carry out the EMR project, which we did. And when you think of Samsung as a company, you would think naturally about products such as TV and other electronics, but one of the key strengths of the group is mobile technology. So from the early 2000s, we decided to engage in communication with the patients based on mobile. Nowadays, we have Google Android and Apple's iOS. At the time, we used Palm OS, based on which the patients were able to schedule a consultation. It's been 30 years, and we can see that Samsung Hospital upgraded itself once every decade. So we adopted OCS or HIS in 2003, which was not easy for the physicians to write prescriptions on computers. And in 2016, we upgraded our system again. I don't know if you would remember the DOS system on your computers, and from the 2000s, there was a transition to Windows. So a lot of things are web-based these days, but in the past, every user had a different login interface. So since 2003, we've upgraded the system every 10 years, and now we have AI, cloud, and robot that are used for big data. So we currently are trying to migrate toward the cloud.
심플하게 요약하라 그러면 이 장표가 됩니다.
So this would be a simple summary of our system.
병원 안에 있는 의료진
The box in sky blue are the tools used by our physicians. When a patient comes in, they consult with them and write charts and write prescriptions and carries out tests. And
환자를 우리한테 보내고 나서
at the top, you can see the physicians outside of our hospital, how they cooperate with the physicians inside Samsung. Of course, they need the consent from the patients to send information. And since the early 2000s, we had our patients use mobile or websites to make a reservation or confirm that or make modifications.
주로 인터널 리서치
At the bottom, you can see the internal tools used. The orange box shows what's used for clinical research. So it's been 30 years, so 4.5 million people, which is 1/10 of Korea's population, is the number of people for which we have data in the hospital. And we also carry out clinical research, work with Gangwon-do Province. We also work with Kakao Healthcare. So we do have a lot of data, and that raises the potential for collaboration. And the white part are the tools used by our executives.
페이션트 센터드 하는 솔루션들이 많습니다.
And you can see we have a lot of patient-oriented, patient-centered solutions. Patient reports, checking in and printing out the work records. And when patients are trying to get admitted to the hospital, all of the processes are based on mobile and web. We also use this digital system to work with other hospitals, as well as pharmaceutical companies and
데이터의 흐름으로 보면
healthcare clusters.
왼편에
This shows the data flow. On the left, there's a pillar showing activities that happen in the hospital. And on the right, you can see the external system.
녹색처럼 데이터가 흘러가는 거예요.
And the green arrow shows the data flow between the two
제가 이제
entities.
가장 많이 듣는 질문 중에 하나가
One of the questions that I get the most often is, why do you make so much investment? What for? Because sometimes IT investment does not immediately provide you with benefits. So some are skeptical about our massive investment in IT systems that reaches several $million.
팀스라는
So I thought a lot about the maturity model to answer this question, and overseas, a lot of hospitals were using the HIMSS maturity model. So we carried out validation on the infrastructure model, moving on to EMR validation, then digital imaging. And most recently, we gained assessment on analytics. So for
스테이지 7을 거치고 못한다는
quadruple areas, we achieved the first record of quadruple stage 7 record.
저희가 뭐 에코시스템 개념에서는 보면
In terms of ecosystem,
진료 영역을 그린 영역의 색깔을 많이 씁니다.
the green is the clinical domain. We have clinical related models
영 효율화,
and also operation management models to raise the efficiency of business operation.
캐모에 대한
And Edward also mentioned CAMO, and the operation management domain includes resource management. And because we are a general hospital, we also have clinical research domain where we continue to develop.
사례를 여기까지 해왔던 하나의 그
So I've explained the history of what we have done in Samsung. Let me now talk about some examples. So as a hospital, we made a lot of investment. And this is the picture of our lobby before COVID. You may think there aren't many patients, but to my eyes, it's very crowded. And our hospital has a very crowded lobby all the time. And I was thinking whether we need to have these patients waiting at the lobby.
병원에 어떻게 하면
So
행복해질 수
I'm always thinking about how to create a happy environment surrounding the hospital. You may think
케어하고
it's irrelevant, but patient care and cure
하는 것은
are
행복을 추구하는
all processes that lead us to the destination of a happy life.
해야 되고
So that's why we need to think about how we can create a happy environment
그런 슬로건을
surrounding the hospital. So this is our slogan.
위전과 미션과
Based on that slogan, we have the vision and mission, and we thought about how to achieve these visions and missions in a strategic way. That's how we came up with the 5 strategy.
중심에는
And at the center of the strategy,
다른 데서
we have the cutting edge intelligence based hospital. We want to use intelligence to support the stakeholders. That's the foundation.
전문가들, 당영역의 전문가들도 모아서 7개의 태스크포스,
And we
7개의 태스크포스에서는
grouped
각자 말도 안 되는 자기
domain experts to organize 7 different task forces.
말도 안 되는 얘기들을 다 토해내게 해서
This is where people can come up with any kind of idea for the development of the hospital safely, and the discussion would be the basis for us to come up with a strategy to advance the hospital. So after listening to many different needs, I thought people don't want to be in the hospital. As a patient, you want to come to the hospital very rarely, and even if you have to, you want the process, all the process to be very quick, and you want to return home quickly. So we thought there are many things what you can do without having to visit the hospital. Of course, you would need in-person treatments,
모바일로 보내고 웹사이트
but there are other things that could be done on mobile or websites. So for that, we came up with the term connect and through. Then we started looking at many different technology in the world. At that time, the technology explained what the acronym ICBM of the Fourth Industrial Revolution stood out. So we consider these technology, including AI and robotics. Technology, strategy, and the data flow are all important elements, and we also needed to think about the application. But this chart looks very simple, but it's actually an expensive one because it took a long time investment for us to get here. So we try to apply technology in a patient-centered manner. For each step, we apply the technology in order to raise the convenience of the physicians and nurses and to ensure a happy life for our patients. Now let me move on to case studies. So in the past, when you wanted to get admitted to a hospital, you needed to consult with the physician and you would go under tests, and the physician will decide whether you need to take medication or get operated or get chemotherapy. So what types of intervention are needed? Then this creates the expected admission date. In large hospitals, you are not admitted on the day. You schedule an expected admission date, and then we send a text to the patient notifying the exact date where they need to visit the hospital. And of course, there's a wait time in the lobby. You need to sign around 14 consent papers. And I don't know if this still exists, but you also need the signature of someone who will vouch for you. And you needed to go through all of these processes to get your bed. But nowadays, it's all on mobile. The consent is also collected based on mobile, and the display for the patient will also change to show information that they are admitted. And in the ER, people come to the ER thinking that when I go to the ER, a person in a white gown will answer my questions. There are physicians, radiologists, and nurses engaged in their tasks, and the patient don't know how long they need to wait and when they will be consulted for. And it's also hard for the physicians and nurses to understand the wait time for the patient. So we analyzed 6 months worth of data for 3 years to derive how many minutes a patient need to wait in the ER to get the next test or to meet with a doctor. So we created a dashboard so that the patient does not have to actually ask anyone. And even when they ask a question, the staff member nearby will be able to immediately answer their question by looking at the dashboard. This is my picture. I didn't want to use someone else's picture because I had to get consent due to recent regulations. And you can see the current status of the robots, whether they're being charged or where they are in the dashboard. And there's another dashboard showing how many months it will take for a new patient to schedule a CT scan or so. And in the hospital, there are a lot of demand for the same day tests in emergency cases, but we have a lot of reservations. So it's hard to get a CT scan on the day because there aren't many CT rooms. But when a no-show happens, if someone does not come for their reservation, that's immediately alerted so we can use that time slot. And when Samsung Electronics comes up with a new mobile device, we try to adopt that as soon as possible. And we also use Galaxy Tab to take memos and record the voices and opinions of the patients. And physicians, when they make a tour with their nurses, they have to make a lot of discussions, and they print out some paper and chart to color the outlier blue. And we understood this demand and need, and now physicians can use the Galaxy Tab to show the information about the patient, and whether they could also use this to record voices. And around 30 minutes a day is saved for physicians by using the tablets. For these people who are extremely busy, saving 30 minutes means a lot. So this is the outpatient service.
Reservations for appointment are made in various ways, such as visiting in person, connecting to the other hospital, calling, homepage, or mobile. Visible ARS of Samsung Medical Center, which introduced Visible ARS, is the most frequently used phone reservation system. It's a service that helps you make appointments easily and conveniently. If you call to the representative number with the help of a highly developed system, you can make an appointment appropriate for you. A phone call at any time makes it easy to check your appointment schedule, as well as change your appointment and examination reservations. Patients can also make a reservation through mobile. Patients can find appropriate medical staff to make an appointment according to the search disease or symptoms, and can easily change or cancel them. If patients register their vehicle and card information in advance, They can use the hospital much more comfortably. Patients can fill out the questionnaires needed for treatment on mobile at home before appointment. Unlike when writing in a hurry on the day of treatment, they can enter symptoms calmly and without exception. Hospital staffs do not have to enter the results directly into the hospital system, and they can immediately check the patient's pre-submitted questionnaire data and use it for treatment. In the case of diabetes patients, more special management is possible. The patient can link daily blood sugar levels measured by a blood glucose meter at home to the mobile app and record diet and insulin information. The mobile app can also be linked to the Samsung Health app to manage information such as the number of steps, heart rate, and blood pressure. The saved life log data can be used as a useful reference for hospital treatment. If a special event, such as hypoglycemia or hyperglycemia, occurs among the patient data, a management message is sent from the app, and sometimes the medical staff directly contacts the patient to provide additional management and training. After a simple questionnaire through a message received a day before the appointment, a QR code pass is issued. If patients pass the hospital gate with the issued QR code, today's summarized schedule will be sent by text message, and a timeline that can be seen at a glance will be provided on the mobile app. After passing gate, various non-face-to-face services are available on the timeline provided. Patient can apply for outpatient appointment or examination with a single touch. Patient can view the standby status on your mobile electronic display. It also shows patient the location of the next stop on the map. The hands of patients visiting Samsung Medical Center are light. The medical data of other hospitals is linked, so patients don't have to bring the documents separately. Medical staff can check the records or test results of other hospitals through the Hospital Information Exchange system. After the appointment, a payment list for medical expenses and a prescription issuance guide will be sent to the push message of the mobile app. Payments can be automatically paid with a card registered in advance, or can be made with a convenient mobile app regardless of location. Patient can also pay in person or through the kiosk. In addition, in mobile apps and kiosks, patients can receive medication by selecting an external pharmacy to visit and sending electronic prescriptions. While using Samsung Medical Center app, patients don't have to wait long at the administration or pharmacy. When patients return home, they will receive a patient experience satisfaction survey message. If patients enter their opinion on the good or uncomfortable points during treatment, the hospital will continue to analyze and improve them. Samsung Medical Center is always trying to listen to the patient's voice. On the Samsung Medical Center app, which patients accessed at the end of the day, they can check the medical treatment and examination results, drug prescription history, etc. If patients have forgotten the bills, they can process it through mobile. They can also get for a copy of their certificate or medical record on mobile and get it in the form of a PDF file.
만들어 놓고 많이 쓰는 것도 있고요. 실제 못 쓰는 것도 있는데 이번 영상이 막 돌아다녀요. 그래서
When hospitalization is decided at the last outpatient treatment, patient can check the reservation status through Visible ARS. After checking the ward, patient can select room type that is private, semi-private, or shared room. Patient can easily watch preparations before hospitalization through apps and YouTube contents. On the day of hospitalization, patients can check in advance through text messages. Patient can complete all hospitalization procedures through the mobile app without visiting the administration office. Patient can check previously selected rooms and change requests if necessary. Fill the information related to the COVID-19, Read all the consent forms necessary for hospitalization and sign and submit them. If the procedure is completed, patient can just visit the assigned ward after arriving at the hospital. The patient's name is marked at the entrance of the hospital room, so patients can find the assigned room accurately and easily. The bed card in the bed is digitalized, making it easy for medical staff to check the patient's precautions and various important information once again. Nurses can greatly reduce the risk of errors by checking 5 rights through the BPOC machine before administering medications to patients. Before identifying the vital signs, scan the patient's ID with the BPOC machine or the barcode of the patient ID. If nurses check patients' blood pressure with a blood pressure machine and scan the QR code, the blood pressure results are entered into the Darwin system. If nurses take a picture of the pressure ulcer area with a BPOC machine when a pressure ulcer is suspected or found, the AI system analyzes photos to identify the stage of pressure ulcers and recommends dressing and future treatment plans. Medical staff can easily send educational videos to patients through the SMS, and patients can learn on mobile at any time after discharge through the URL they received. While hospitalized, patients can check hospitalization bills and pay in installments through mobile at any time without visiting the office. Patients need to claim personal insurance money after treatment or discharge. If patients link data with a mobile app, they can easily claim insurance money from the insurance company without issuing various documents or filling out applications. If patients need a copy of the medical records, can apply at any time at the Samsung Medical Center website or mobile app without visiting the hospital. The medical records that patients applied for are issued in the form of PDF files with electronic signatures, making it convenient to download.
Medical Center, a remote route.
회진동 로봇인데요. 이건 넘어가겠습니다. 그래서 저희가 실제로 개발을 해보니까
So after developing,
많이 쓰고요. 외부와
the usage rate of internal apps was very high. And for outpatient or external domain related apps, because of various regulations and laws, they weren't used that much, especially the part that's linked with pharmacies. So we need to make more improvements in the future.
알려지다 보니까 1년에 한 30개 나라
So awareness, I mean,
기계팀이 해외에서 와서
this IT system of our hospital has been promoted widely. So nowadays, a lot of overseas organizations pay a visit to learn our case. So we're making a lot of efforts, as do other organizations. And I think the difference is that we have a good governance system and a well-established strategy.
Provider from South Korea has been globally recognized by HIMSS as a model smart hospital. Samsung Medical Center. In 2022, it was the first hospital in the world to achieve Stage 7 for the INFRAM, a maturity model that assesses and maps an organization's technology infrastructure capabilities required to reach clinical and operational goals. The next year, the hospital achieved yet another global first with a Stage 7 validation for DIAM, a model that assesses capabilities related to the secure delivery of medical imaging. In addition to the maturity model validations, SMC also topped the HIMSS Digital Health Indicator Global Ranking in 2022 with a score of 365 out of 400. The DHI measures a healthcare organization's progress in building a digital health ecosystem.
삼성 서울병원이 디지털 트랜스포메이션을 시작한 것은 1994년 개원을 하면서부터라고 생각합니다.
We started digital transformation in 1994 when we launched. At that time, we wanted to become an advanced smart hospital, and in many areas, we wanted to differentiate ourselves with other hospitals and spared no investment in IT. After the fourth industrial revolution, robotics, AI, and other new technology have been adopted for patient-centered care, and I think that led to our success. While pursuing digital transportation, we always put patients at the center. We want the patient to be safe and experience a fast, convenient service all the time. To this end, we ease the burden of the physicians.
스마트 병원에 대한 정의는 이해관계자마다 다 다를 수
So there can be many different definitions for a smart hospital, and Newsweek's annually reports the world's best smart hospitals, and it uses different indexes.
저희가 결국은 마지막으로 말씀드릴
So as I've mentioned, we're always focused on the patient journey and making the patient and physicians happy. That would conclude my presentation. Thank you for listening.
Thank you very much for sharing your strategies in making the best use of digital transformation focused on the happiness of patients. Like your slogan says, care together, happy together. So let's give Mr. Che another big round of applause for that wonderful presentation. And let's move on to the third presentation on the topic of clinical collaboration, a global perspective. Mr. Jitu Jos, Vice President of the International Patients Division at Apollo Hospitals Enterprises, will deliver this presentation. Apollo Hospitals Group, one of the fastest growing companies in India, has been gaining attention worldwide for its various achievements through digital healthcare service platforms such as Apollo 24/7 and Apollo Health Co. So as we invite him to the stage, let's give a big round of applause to Mr. Jitu Jos. If you're ready, okay.
Very good afternoon. And at the outset, let me thank the organizers of Medical Korea 2024, the Ministry of Health, and the KDA for organizing such a fantastic event. And I'm delighted to learn a lot from here from yesterday. This is amazing. And as we start, can I have the video? Thank you. So I come from the world's largest populated country, and I come from the southernmost part of India. It's a place called Kerala. And with a grateful heart, let me introduce my presentation. So at Apollo Hospitals, our journey has not been an easy one. As you all know, when you have a country with a large population, you have a lot of challenges, especially with the non-communicable disease burden as well as the communicable disease burden. And India's story has not been very easy post the colonial era. And we had a lot of restrictions in terms of technology entering the country. And that was when Apollo was born. My chairman was a cardiologist working in the United States, and in one of his vacation, there was a patient brought to him with chest pain, and he wanted to do an angiogram. His friend said, Dr. Reddy, there is no cath lab here. He was surprised that his country did not even have a cath lab. I'm talking about the 1970s. And that was the reason why he envisioned that India should have world-class healthcare and should prepare its healthcare workforce, and that's how it started. Today, we have revolutionized the way healthcare is, and we have learned from the best centers in the world. And hence, we always advocate that clinical collaboration is an important step. The last two presentations, you saw how technology is transferring. So as we leverage this, let's keep in mind that there are many in the world who still needs our support. And the way forward in healthcare has to be a shared responsibility. So Apollo, today, after 40 years, we have reversed the brain drain. As you know that India is one of the global suppliers of IT professionals, and followed by that it is medical professionals. So when my chairman returned, he also had shortage of doctors. Today we are happy to say that 80% of our doctors are from the UK and the US, and we have reversed India's brain drain for doctors in the healthcare field. And we are into the entire spectrum of healthcare, whether it is pharmaceuticals, whether it is creating the secondary care centers, retail pharmaceuticals, health insurance, and as a value-based, outcome-driven model, we are across the healthcare spectrum. Harvard conducted a case study on how we have reversed it, and it's available as a public document today. So we are into the entire spectrum of healthcare because we also have a huge responsibility when we cater to a country as large as India. As clinical pioneers, we have looked at every aspect, whether it is clinical excellence, delivering service excellence, and also execution excellence. I'm happy to say that we are one of the first organizations in South Asia to get the Joint Commission accreditation. And today, all our leading hospitals across India are GSA accredited and re-accredited ones. And of course, the world-class outcomes definitely require systems and protocols. And we have looked at this. And when we had to get the system in place, the best thing that happened to us was, since we had experts from all over the world, we could get the best and we could combine it and get a model that would help us. We are the first organization to publish our clinical scorecards on our website. Indian healthcare delivery is witnessing a lot of changes, and India is emerging as a global hub for medical travel. And personally, I handle the international affairs of the company, and we receive patients from over 120 countries. India's advantage is the healthcare manpower, technology, and affordable healthcare. Now, whenever we say affordable healthcare in India, people attribute it to the fact that how can you give affordable healthcare when you have private and public? Keep in mind, our affordability also comes from the currency rate exchange, and again, the fact that we have a huge social healthcare system. We are one of the largest socially insured populations in the world. Why do we need clinical collaboration? Whenever we reach out to the rest of the world, as an administrator, the challenges that I face today is how do we associate with each other? How do we learn from each other? What is that we can share? How is your disease pattern and how does that compare with mine? Over 50 countries where we work and where we have established our presence, we have come across this. And the reason that we say clinical collaboration is a way forward is because of the ever-increasing NCD burden, the changing disease patterns, and of course, Many of the countries that we see, they need super specialty and subspecialty support. And finally, healthcare has to be a shared responsibility. I was part of the WHO Afro, and I told them the problems that we faced in India with 1 billion people is equal to the problems of Africa as a continent. And when you look at our experience of the last 4 decades, the learning curve becomes much smaller. And that's how clinical collaboration becomes an enabler in connecting healthcare. And how it works is on 4 aspects. The simplest way is knowledge sharing. Second aspect is the way it connects people. The healthcare professionals needs to be connected. Third, of course, you can look at a commercial aspect, you can look at a business aspect, you can look at an academic aspect. There are a lot of mutual benefits. And the fourth part is when you look at a center which has growth aspirations, by clinical collaboration with the provider with more clinical bandwidth, more expertise, you are adding clinical bandwidth to your partner centers. So to summarize, clinical collaboration becomes a beautiful enabler. There are multiple formats, and as you know that in healthcare, today with all the technology that we have, there are a lot of challenges in terms of how healthcare can associate data privacy issues, the licensing terms, even you look at the medicines and the prescriptions, the ICD code compliance. You have a lot of challenges when 2 organizations in 2 different countries have to work together, and finally for a doctor to treat a patient and even to conduct an academic program. So we use multiple formats in our clinical collaboration. So it can be a simple workshop, it can be a proctor program. So for example, some of the GCC states, the only way you can conduct clinical programs in the center is through a proctor license. In certain countries, this can happen as an on-site surgery programs where you take a department out of a hospital, run it for them, teach them, learn, and that also helps them to learn ways. We have established such surgical programs in western part of Africa. We have done that in the eastern part of Africa. We have established bone marrow transplant units like this. And fourth, of course, is through the technology enabled Telehealth Connect. We are one of the largest telehealth service providers, and we cover 30 countries across Asia and Africa in telehealth connectivity. I'll come to the details a little later. And of course, it's not easy to look at an MOU for clinical collaboration. Every country has its norms, terms and conditions in terms of what is a license to practice for a doctor. And if at all the doctor is going to deliver a service in that country, indemnity becomes a big aspect. How do you work around that, or what is the solution there? Then there are changes in the clinical protocols that we see across the globe. So what we follow in Europe versus UK versus the CIS versus Africa versus Southeast Asia, everything changes. So we need to have an understanding of where we can reach an engaging model. And of course, the confidentiality of data. What is the data that you can transfer? What is the data that you can access? So keeping these legal aspects in mind, we progress on relationships. Now, a couple of things that we do in terms of the legal aspects for clinical collaboration is, when it comes to the MOU, the jurisdiction is always kept as a neutral territory. In India's case, we look at engaging others using the English law and a neutral territory aspect. In terms of the data privacy, today with different and more strict regimes, we look at a mutual consent-based data privacy model. Indemnity is always based on the host country that we work in, so that we can comply to the terms and conditions and work around that. Whenever there are payments involved, insurance providers involved, we try to keep it at 30 to 45 days payment terms. And doctor's license, so it's again based on the licensing, the data flow requirements of each country. So this is how, and these are the 5 important aspects that we need to keep in mind when we need to associate with institution, university, healthcare provider abroad. And our success story, we have successfully established our tele-radiology services in the Europe. We are running and routine on-site surgery programs across East and West Africa. We have our medical education and super specialty clinics in South Asia. We do on-site clinics, and we also have our direct presence in some of the CIS countries. And in terms of North America, we have our clinical affiliations in the US and in Canada. And it has been an evolving journey. And one of the important enablers today is, of course, the telehealth service. Way back in the year 2000, Bill Clinton, the then President of the United States, inaugurated Apollo's telehealth service. Last 23 years, it has been a very exciting journey for us using telehealth. And today, we have touched over 20 million individuals, and I guess almost half of Korea's population, yes. And this has been a big support system, and especially during the pandemic, for patients with NCDs, accessing healthcare during lockdown and all was a great challenge. So we, of course, used our mobile applications and telehealth to ensure that the patients were taken care, the reviews were not affected, and we also supported the 30 countries which were connected to us on our telehealth. And teleconsultations across the world we have been doing. And as you know, India is a large country, and we manage one of the highest located telehealth centers in India for a village of 3,000 people who otherwise needs to travel 18 hours by road to access the nearest healthcare center. And this has been supported by the government of India. And I presume that this is the highest located civilian telehealth center in the world. Apollo Telehealth has also looked at the entire spectrum, right, from tele-emergency, tele-counseling, tele-pathology, tele-laboratory, teleconsultations. And we are happy to say that this vertical has become the biggest enabler for us in our journey of clinical collaboration. And it is also helping the academics, and also the students are connected through this. This is a sample of our tele-emergency center, and it's connected to our centers. Again, another way this helps is, we all know for sure that there is a supply-demand gap in the healthcare manpower. And the only way the world can progress and face the challenges is by leveraging technology. And tele-emergency has been a big support, especially within India, and we are also helping the countries within the same timeline at the moment on tele-emergency. Our close neighborhood countries like Bangladesh, Sri Lanka, Maldives, we help them on tele-emergencies. This is another innovative thing that we have started, is the digital dispensary. Again, this is something that we are allowed to do only within India at the moment. As I told you earlier, there are restrictions in terms of what you can prescribe, the license of the doctor, and also the generic that they need to mention. So we are operationalizing this only in India at the moment, and this has been a big support for the peripherals of India, the villages of India. Teleradiology, again, when you look at the shortage of doctors, another important aspect is the shortage of radiologists everywhere. And teleradiology comes in as a big support. We work with different countries on this based on the qualification of doctors that they look at. So for example, when we are doing this for UK, we ensure that the doctors are UK passport holders, qualified in the UK, CCT completed, so that there is no license issue in terms of the advice given by the doctor sitting in India. So teleradiology has been a big support, and it has been another enabler in terms of helping other centers. This also helps a lot with small island nations like Maldives, Mauritius, etc., where they have a huge shortage and they find it very difficult to get MRI reports and CT scan reports interpreted on time. So to conclude, we need to leverage technology, have shared goals, and of course, there is an opportunity cost. Unless we balance all this, healthcare providers will not be able to continue their mission of saving lives. Uh, as I told you, we are a world faced with an enormous challenge posed by the NCDs and ever-changing disease pattern, which we were not used to. And unless providers, governments, Ministry of Health all join together, we won't be in a position to sort out and prepare ourselves for the future. And we definitely have a responsibility. Thank you so much. I have you've been watching my face. I put babies from all over the world. This is a future that we are responsible for. You, me, and everybody. For us, the biggest responsibility is to make a world safe for them, healthier for them. And thank you so much.
Thank you very much for that presentation, and thank you for giving us that global perspective in clinical cooperation and collaboration, that is, such as through on-site workshops, as well as on-site surgery programs, proctor programs, and telehealth connection. Let's give Mr. Jose another big round of applause. Now, despite it being the late afternoon, I think everyone appears to be very focused thanks to our esteemed speakers and the informative presentations. Now, we have a few more presentations left, but we're going to have a roughly 15-minute break. But also, I want to mention once more that your participation matters a lot to us. So it would be great if you would participate in the satisfaction survey for this event by scanning the QR code displayed, that should be displayed on the screen maybe now. So we sincerely request your keen interest and active participation in our journey towards. Oh, we're actually not going to have a short break. It looks like we're going to have our next presentation ready. So if you really must need a break, you may just quickly take a rest and then come back. But we're going to continue with the fourth presentation. So let me introduce the fourth presentation, which will be held by Mr. Hyun-Seok Choi, CMO of DeepNoid, who will present on the topic Considerations in Developing Medical AI Software. DeepNoid, which aims to make AI easily understandable and accessible to everyone, seems to be the most suitable organization to explain the theme of Medical Korea 2024, which is Healthcare for All, a New Horizon Beyond Barriers. They have published a paper in the American Journal of Neuroradiology demonstrating that even doctors who are not radiologists can increase diagnostic accuracy using artificial intelligence. So, ladies and gentlemen, please join me in welcoming him with a big round of applause.
예, 소개 말씀 감사드립니다. 저도
Thank you very much for your excellent presentation.
영어로 하는 것보다는 한국말로 하는 게 전달력이
I think it would be better to conduct my presentation in Korean because there's more Koreans in the audience.
남자들보다 스코프이 좀 작은데
I think the scope of my presentation is narrower than the previous speakers, but that doesn't mean that my presentation won't be interesting.
스타트업에 계시는 분들도 있습니다.
In the audience, I believe there are some startup people and academics and researchers.
경험을 좀 나누고 싶습니다.
So I would like to share my experiences with you.
세 파트로 구성을 했는데
My presentation consists of three parts. First,
제가 이제 교수 생활하면서
I used to be a professor.
관심을 갖고
As a professor, I researched AI, and also as a CMO of DeepNoid, I have experiences of getting approval
두 번째는
for a product and also commercialize them.
공공의료병원에서 일하는
And as a user, also I worked as a primary physician at a public healthcare provider. So what kind of helps I got from AI and technology? I want to share that with you too. Lastly, in my presentation, I'd like to talk about the trends and future trends centering on brain disorders.
그 뇌동맥류라는 병은
Cerebral aneurysm.
이런 병인데요. 다들 뭐 여기
I'm sure you're all healthcare professionals. You are all aware of this disease, right? The cerebral aneurysm is a condition where the blood vessels in the brain get swollen up and gets busted. But if the blood vessel doesn't explode or doesn't break, you will have no symptoms. But once the blood vessels gets busted, either you will die or you'll get a lot of disability. So we wanted to find out how to find the areas of the blood vessels which are likely to get busted. So 1 out of 100 people have this aneurysm. And there's a rupture case, of course, but there are so many patients without any rupture cases. I believe at least 1 or 2 people in the audience here might have the cerebral aneurysm without symptoms. So if you just miss the prime time or golden time, if that blood vessels in your brain gets busted or ruptured, then the result will be really catastrophic. In 2018, the Korea National Health Insurance Corporation expanded the insurance coverage for the national public. So MRI became reimbursed. So the number of cases where people get MRI scans jumped twofold. But reading the MRI scans is a problem due to shortages. And also, if the brain blood vessel rupture happens and a lot of care is needed, so it can cause some disease burden like that. So our solution to detect the cerebral aneurysm, it was reimbursed, and the detection rate is almost 91% in accuracy. I have a lot to say, but it seems like I can't just touch upon everything. So I will just focus on cerebral aneurysm. So at the beginning of my presentation, I said we were trying to develop solution to detect brain aneurysm, right? And the detection accuracy rate is 91%. You might be disappointed about it, right? But still, our solution is really helpful. I was a physician myself for about 18 years. I was a physician of neurology, and I think my score as a doctor, I think it was 98. I didn't get any lawsuits for failures to detect brain aneurysm. I think it was thanks to the excellent healthcare team. And I got a lot of help from even my students and the colleagues. So thanks to this collaboration and help from the great network, I was able to prevent my patients from progressing to really dangerous stage. So our solution is based on AI. So the brain blood vessels
그 혈관을 따라서
So there are main blood vessels in the brain,
흡수하는 건 별거 아니고요. 혈관을
and
감시하는
we create
영역이
3D
지나간다고
patches.
한
So
환자의
these patches
그
are
혈관을 패치가
monitoring
로테이션하면서
the
이동을
blood
하게 되면서
vessels in
수천
the
개의
brain.
패치를 우리가 한 환자에서 뜯어낼 수 있습니다.
So we can
그걸
actually
이제
extract thousands of
클래시피케이션이 되는 두
patches
번째로 지금
from
제
a single
가운데
patient.
그 블록입니다.
So when you look at the middle part, it's called
양성인
classification.
패치만 우리가 수출합니다.
So we only
양성인 패치는
extract
뭐 뇌동맥
positive
성분당 20개 정도
patches. So from a patient with a cerebral aneurysm, we can get about 20 positive patches. And using that, we conduct segmentation.
파운딩 박스, 저 빨간
There's a founding box, the
상당히
red one
비슷한데 이제 저게
in the
어떻게
picture. So it's pretty simple.
프리시전 다이그노시스를 도와줄 수 있는
And this process can help the doctors with precision diagnosis. So our product is outlined like this. After all, my company is a profit-seeking company.
연구용으로
So our product should be reimbursed so that it can be widely used. Without reimbursement, maybe our product can be used for academic purposes. But in order to make money, we need to make sure our product is reimbursed and covered by the National Health Insurance. In order to get covered by the National Insurance, we need to be classified as new technology. But our solution didn't, at the beginning, our solution did not measure anything. It only detected it. So we improved it later so that we could get approval from the National Health Insurance.
진단을 좀 해줘야 됩니다.
And also, in order to get reimbursed, our solution had to be able to diagnose with less error rates. The last stage is called beyond here. Our solution had to predict the prognosis. When it comes to brain aneurysm, we should be able to tell whether this person or patient might have the brain blood vessel rupture or not.
정부의 방침에 따라서
So we followed the government's protocol.
혁신 의료 기술이라는 카테고리를 만들어서
So we met the criteria for the category of innovative technology. So it's either category B or C. So our solution was reviewed in those categories. And last fall, the review was conducted. So as a result, our solution is now being covered by the National Health Insurance. So I believe as it is being widely used, we can get more data and we can make more meaningful reports. So you just saw the media coverage about that. And with the help of many doctors in many different specialties, we wrote this paper. So deep learning-based software improves clinicians' detection sensitivity. That is the gist of this paper. So our AI solution is 90% solution compared to people's accuracy. You might wonder how it can improve clinicians' detection sensitivity because our solution is just 90% accurate. But I thought that our human clinicians' accuracy rate is not 100%. Their detection accuracy is also close to 90%. So based on such hypothesis, I approached the question of this thesis. because human clinicians are really busy. I think our solution can help them. So human without CAD assistance, their accuracy, humans, doctors' accuracy was low, but by applying our solution, the detection sensitivity of human doctors increased. And neurologists actually received a lot of help from our solution. And without using our solution, there was some issues. Test 1 is the pink dotted line. It was detection without AI. The green line shows the detection with AI. So we could see meaningful increase in detection accuracy when they get assistance from AI. Now, so far I talked about how we developed our solution and how we received approval. So in total, it took 6 years until we got approval from the authority. But it was a past story. But nowadays, in order for you to get the approval and to launch your product, it only takes like 180 days. At university hospitals, there are many health professionals ranging from doctors to nurses. So they do not have shortage of manpower. But when you go down to remote areas or local cities, there are not many doctors. So maybe only one doctor is working there. So they have no doctor to consult with. So they feel anxiety about the accuracy of their diagnosis and decisions. So we actually introduced our solution to Seoul Medical Center. So once they take CT or MRI scans, then these images are being processed by AI, and then they can be utilized to help assist the decision of doctors. The seamless data transfer, automated analysis, and effortless integration. All this should be possible. If this process is cumbersome, no doctor would want to use it. There's a rapid AI created by Stanford Group in the US. The SK CNC in Korea created SK Insight Plus. So for these two solutions, AI integration satisfaction rate was really good. So without doing specific the manipulation, they actually produced a really good result. Perfusion map, angiography, hemorrhage. So all this information was easily identified. So the AI solution greatly reduced the team approach efforts and time. And the hemorrhage risk is shown in the form of score here. And there's a red flag, which refers to high-risk patients. High-risk patients are prioritized. So AI solution can do that. That way, it can increase the efficiency and effectiveness of treatment. This is quantification. When it comes to data transfer, certain level of manual work was required, but it was a little bit cumbersome. But still, this AI solution visualized data for both patients and doctors to easily understand. And Like you see in the right bottom side, you can see the changes of brain scans. So 1 year before and after the brain aneurysm, so it shows the changes in aneurysm. So this can actually help doctors to take proper directions. In CT and MRI, we have a lot of unstructured data from the MRI and CT scans. The calcification, the tortuosity, and thickness inside blood vessels. So these are being visualized, and AI will automatically extract data naturally soon. This is the hemodynamic information and the lining of the blood vessels and the thickness of the lining of the blood vessels. All this information is shown. So vessel wall enhancement areas are the rupture points. That is very well known. So our solution cannot be just welcomed by the doctor only for its detection function. So rupture prediction and hemodynamic information should be added. That way we can better help our clinicians and doctors. So when we develop AI software, what things we need to consider? So based on my experiences, I want to share some insights. We need to focus on severe diseases. So if a patient dies, it will be a serious problem, or you might be subjected to legal battles or lawsuits. And there's a shortage of healthcare professionals. So you need to prioritize severe diseases first. And also you need to focus on non-communicable diseases or chronic diseases. Degenerative brain disorders such as Parkinson's and dementia. So these diseases should be prioritized when you develop AI software. And also curable diseases should be the focus when you develop AI software. This is our competitor's product, JLK's total analysis method. So from CT, they check there's no hemorrhage, and they identified blockage, and they also created a perfusion map. That map actually tells you what part of brain you can salvage. And the origin of the thrombosis is also identified, whether the thrombosis originates from the heart or other organs. That information can be identified. And also the bleeding can be quantified as well. In the past, we actually write down the reading results in the form of text. But when we write the text when we write a text as a healthcare professionals, our subjective interpretation is included. But when the AI does that, there's a less room for misunderstanding between healthcare professionals. And acute ischemic stroke, this disease meets all the criteria that I just mentioned as the important criteria that you need to consider when you develop the AI software. This is another product from one of our competitors. Huron created this AI. This actually detects nigrosome. You know Parkinson's disease, right? Nigrosome is the cause of Parkinson's disease. So nigrosome is detected, and the detection accuracy rate is the low 90.
도파민 트랜스포터를 보는 가장 정확한
Dopamine transporter test.
성능을 보였다고.
There's a conventional dopamine transporter test, and this AI's accuracy rate is comparable with that of a dopamine transporter test. You might not see differences between these two cases. So AI can actually find the problematic area and can measure it. Parkinson's disease is a severe disease. It's not completely curable, but with the drugs and surgeries, it can be managed, and it is a chronic disease. So it is an important indication for AI solution. You dissect. This is a NeuroPits product that actually analyzes brain for dementia. So it is quite similar to one of the solutions we saw earlier. And it shows the diagram in the shape of hexagon. So temporal and cingulate can be expressed in a quantitative manner. So it's visualized. So it's very useful and helpful. So by looking at these visuals, you can tell whether your brain is being shrinking or how much your brain function is being declining. This, when you look at this photos, small vessel disease. This is a small vessel disease picture. So AI software can automatically measure whether you have a small vessel disease or not. So AI can read certain areas. So in certain areas, I believe AI will outpace the human doctors. So I said human doctors is 98%, while AI is 90%. But one day, AI will supersede human doctors. So the Go player, Lee Sedol, is not as good as the AI Go player, right? When it comes to measurement, I want to highlight this. So I confess that as a doctor, I didn't measure everything with my patient. Without measurement, we just categorize patients as mild or severe patient. But now with AI, we can measure our patient in every little category. Leonardo da Vinci, Galileo Galilei said, measure what is measurable and make measurable what is not so. So with the AI and algorithm, I think we can make great contribution to accurate measurement. This is the visualization of my imagination. On the left side, it's an acute stroke patient. So with the help of a lot of healthcare professionals and AI, he is really happy and happily recovering. On the right side, even though this patient had some disability as a result of a disease, thanks to AI and robotic technology, this patient can live a normal life. I think that's the role of AI that helps people live normal life. Once again, I would like to thank all the doctors at the Severance Hospital.
Thank
that
you
helped our
for
research.
enlightening us on the topic of developing medical AI software that should help in the prevention and treatment of patients. Once again, let's give a big round of applause to Mr. Choi. And last but not least, we have come to our final presentation of today's forum. Under the topic, access to great healthcare should never be constrained by borders, Ms. Hope Lewis, CEO and co-founder of More Health, will deliver the presentation. Founder of More Health, Ms. Hope Lewis has been dedicated to providing the world's best medical services to patients worldwide for over a decade, primarily through virtual platforms. She truly transcends the barriers of borders, languages, and cultures in her service delivery. So today we are privileged to hear about Ms. Hope Lewis' exceptional journey and experiences. All right, let's welcome her onto the stage with a big round of applause. All right, we are still getting prepared for the presentation, so let's wait a few more seconds before we invite her onto the stage. So this presentation will be the last one of Forum 4, and I think she is ready, so let's invite her with a huge round of applause.
안녕하세요. A lot of people ask me if I'm going to present today in Korean. Sorry, I cannot. I'm a Chinese American born from China. Here is my story. My name is Hope Lewis, co-founder, CEO of More Health. Before More Health, I was an attorney by training. I studied in the University of Oxford, then NYU, specialized corporate finance. When I was attorney, it was 2006. I was in Singapore helping a company public in the market. A chairman has 18 months baby girl, unfortunately diagnosed hepatoblastoma, a rare liver cancer. For me and the family, we seek for many doctors in Singapore, in Japan, of course in China. Unfortunately, all the doctors told us this baby girl only has 6 months lifespan. No one wants to give up. As mother, today, I will not give up at all. So I called UCSF, talked with the vice chancellor, and he asked if the family has financial means to travel to San Francisco. That's how we landed in San Francisco, and this baby girl was admitted in UCSF Children's Hospital. After 2 years treatment, today she's almost 18 years old, cancer-free. Really surprised me is why this is, for me as a lawyer, seeing a person who has a death sentence and a person who potentially be cured. More than that, you know, the family end up spend over $2 million as a cash pay patients. Everybody knows 1 day in NICU is cost $30,000. A month in NICU is almost $1 million. So that's how More Health was founded, from this story. Because I was asking myself, if I have a family member who's suffering critical illness or rare disease, I don't have this much money. And how about you guys? That's how I founded More Health. Today, More Health is 13 years old. And we probably the only and the largest, the leading specialist marketplace. Through this marketplace, we manage the link physicians, global specialists, providers, of course, patients, to find the proper diagnosis and the proper treatment, most likely a novel treatment for the patients. A global healthcare is at a crossroad under the enormous pressure. As we all know, the lack of access to good care leads to up to 6 million deaths a year. And almost approximately 2.5 doctors are facing 10,000 patients globally. You know, one oncologist in Shanghai every day is seeing about 200 cancer patients. So think about if you are suffering critical illness, when you took a month to see a doctor, and the doctor only has 2 minutes for you, and what's the outcome for the misdiagnosis, overtreatment, and so and so. Not even talking about novel treatment, because we really don't have this medical workforce. So for us, I would love you to think about global healthcare, the whole picture as a global perspective, non-US biased, non-Korean biased. Because for anybody, when we're talking about a healthcare, we really think a healthcare is domestic. A telemedicine has to be local. Because in the US, a telemedicine has to be restrained in the states. Not even talking about across states, not even talking about across border. Why? Think about a Korean. Telemedicine is illegal because people think, it's really hard for a doctor to see a patient, to analyze these patients, to meet the patients in person, then provide a diagnosis. Not even talking about a patient in the other country or a doctor in a different jurisdiction, and we are facing a culture difference, time difference, language issue, and most importantly, malpractice liabilities. Plus, every world is different. China, Japan, Canada is a healthcare place. Government would love to spend money and dollars for the education and the prevention. Versus US, the doctors actually are very incentivized to be very, very specialized. So how we are solving this global issue? We believe if we see a healthcare as a global, the problem probably could be solved. Here are improving outcomes through global access. Of course, you can understand. For patients, they are able to, through Morehouse platform, access the doctor who spent 20, 30 years of the research, study, practice in that disease. Later, I'm going to share several great stories. For hospitals, they access global patients populations. Like here in Korea, we want to welcome the global patients to come to the Korea to experience the novel treatment clinical trial. And for life science companies, they are access the candidates for clinical trials with the diversity of the patients. Here is our platform, self-developed, and nowadays are used by many hospitals in China and in the US. Not really only serving the domestic telemedicine, but also serving a global telemedicine. It's able to translate 129 languages. We process the patients from over 180 jurisdictions. And what we believe is practice medicine, not IT. Maybe someone not agree with me, but for us, it's really patients' drive for the next generations of the healthcare. Think about Morehouse. When the global critical illness patients coming to the platform, we organize all the data, including the medical records, DICOM image, pathology image, genetic report, and look for a doctor, a specialist in the field. So what we do is we really mitigate misdiagnosis and prevent over-treatment. And those data are so valuable for us, for the AI implementation, for the education, for the life science companies, for the clinical trials. Because when we're talking about data mining, it's really about garbage in, garbage out. But true quality of the data means a lot. Here is what we do. Leverage the telemedicine platform, and so we can access global patients. Think about before, when I talk about the patients looking for a global leading specialist, I'm never mean to let you know Morehouse is trying to cross-border establish a patient-physician relationship. No, that's impossible. What we do is the patient's representative attending physician on the Morehouse platform have a real-world case discussion with the world leading specialist. Then they are looking for the right diagnosis, proper treatment plan. 90% patients do not have financial means to spend $300,000 or several million US dollars to go overseas for the treatment. But after this co-diagnosis, this collaboration and the discussion, the patients can be treated in the locally. 5 to 10% of patients do have the financial means, and they are lucky enough to travel abroad to the countries, to the US, to the countries like Korea, to access the clinical trial or novel management. And those patients, you know what they do? They spend some time in Korea or in the US, but after the treatment, the local doctors will welcome them back to their own country, because through Morehouse platform, they access the updates and the catch-ups. Our case management are the secret sauce behind the thing. We work 24 hours, access 180 jurisdictions patients, and able to help them to find the right doctors for them. If the patients want to travel overseas, Morehouse is able to serve as a third-party intermediary. The marketplace, the market service as a patient advocate is very important, because the next healthcare is really about a patient drive. Through the media, through the patient advocacy, through the TikTok, through the Instagram, patients want to find out what's the best solutions, whether or not there is available clinical trial or there is a newly approved drug. So those are the patients driving. So let's use this to engage the global healthcare. Last but not least is medical travel concierge. Those 20% concierge patients contribute 80% revenues to hospitals, providers. And those patients are actually not only contribute revenue, but also contribute the diversity for the clinical trials. And on Morehouse platform, we're able to provide these solutions. The time for us is to act. First of all, we could treat the global patients, because like Dr. Marks just mentioned, the Earth is not flat. The healthcare should be global. And besides treat the global patients, you actually communicate with the patient's local attending physicians. Through the patient study, you are actually communicate with the local attending physicians through a real-world case discussion. And the next is to lead the future of the medicine. I really want to share this amazing story. This is the patient. I'm grateful the patient authorized me to let me use his story. This is the patient, Mr. Su. He got lung cancer. Pardon my lack of medical knowledge, but I was told his lung cancer is so rare. In the whole world, only 200 people. And there is no way to treat this lung cancer because we don't have an NCCN guideline. We don't know what to do. And he came to his doctor actually recommended him to look for Morehouse. And through Morehouse, we found Dr. Fasella from MD Anderson, who's kind enough to do the treatment for him. He did immunotherapy, chemotherapy, proton treatment. And this picture is when he finished the proton treatment and ran the gun. And behind Mr. Su, that's his physicians from Guangzhou, China. He's the one telling the patient, you should go to Morehouse, seek for the novel treatment. That might be helping you. Actually, in the whole world, Dr. Fasella spent 30 years doing the research about this rare lung cancer. He's so lucky to get it treated. Today, he's already back to China. And you know what? He's back to this doctor who's all the time communicate with Dr. Fasella. For her, she shared her experience with us. This is amazing experience. She learned so much, more than joining an ASCO, more than joining any conference. See, you are saying this is never still another doctor's patients, right? It's the world is collaborating. When the patient is suffering a critical illness or rare disease, they do have the means to go through Morehouse platform, through telemedicine, look for a world-leading specialist, have a treatment plan. More than that, they might be lucky enough to travel to overseas, to enjoy, to experience clinical trial or write a proper treatment. So today, I'm so happy to be in Korea. And yesterday, I just learned in 2024 Newsweek, there are global top 10 cancer hospitals. It's really not surprising if MD Anderson is #1, Memorial Sloan is #2. But really surprised, everybody is among 10 hospitals, Korean has 3. But why we don't really hear about those 3 hospitals? Why patients going to Singapore, Japan, US, not really Korea? But I think the time for us is coming. Let's work together, promote the reputation of Korean medicine and hospital quality, and bring global patients to Korea hospitals. Of course, through the telemedicine, through the patients traveling here, I believe it's another level of the education for the foreign doctors. Last, I want to echo Yus. He said, today, when we were out here, it's about how to make the world better, how to make our kids happy. And I think, the earth, it definitely is not flat. And through all of our effort, healthcare can be global, not local. Thank you very much.
Thank you very much for that passionate presentation and for sharing the story of More Health. And thank you, Ms. Hope Lewis, for raising the hope for universal access to great healthcare. So let's give Ms. Lewis another huge round of applause. And ladies and gentlemen, that brings us to the end of the forum. I would like to express my heartfelt gratitude to all of you. Thanks to all the participants physically present here until this afternoon. And also thank you to everyone joining virtually. So today, as we have delved into crucial insights on the adoption and utilization of medical digital technologies, it has provided a valuable opportunity for us to both explore the current trends and future directions of the healthcare industry. Now, beyond the conclusion of this forum, I am confident that the value encapsulated in this event will continue to spread. And also to do that, we would also like to hear from you for the satisfaction survey by scanning the QR code that we are going to display you here on the screen. So please take part until March 22nd. We are also conducting a satisfaction survey reward event. We invite your keen interest and active participation to contribute to creating a world without barriers in healthcare. So once again, I would like to thank everyone, especially our presenters and every of the attendants here today. And with that, we are going to wrap up today's forum. Thank you very much. This has been your MC, Sua Kwan.